Thank you for joining me on our Facebook Live today. My name is Angie Taylor. I'm an occupational therapist and a certified hand therapist. I've worked for KORT for 26 years, and we wanted to go live today to talk about carpal tunnel. Unfortunately, Dr. Duber, who was planning to join us, had an unforeseen circumstance, so he's not going to be able to join us today. But we wanted to go ahead and do the live and answer your questions that you may have. So I may refer some things back to what he does from a surgical perspective, but we do have some questions that were already sent in, and so we hope that you join us, and any questions that you have as we're doing this, we'll work with them as we go along. So, Tammy Edlin is here with us. She's our marketing director for KORT South, and she has the list of questions that were sent in ahead of time, and then we'll also be looking at the questions that you're submitting for us to answer as well.
Angie, the first question somebody had sent in is, what is carpal tunnel?
Okay, so basically carpal tunnel is it's the median nerve, and it is a compression of the median nerve, and it's particularly in the wrist. So the nerve actually starts in the neck, and then it travels through the arm, and then as it narrows into the wrist, it has an area of where it can be more compromised. The floor of your carpal bones, or the floor of your wrist, are your carpal bones, and so then you have a tunnel, and all of the tendons that attach to your fingers and the median nerve run through that tunnel. And so what happens is sometimes with increased activity, with increased weight gain, pregnancy, things like that, that tunnel can get a little bit more inflamed and swollen. And so when that happens, it actually compresses on the median nerve. And when you get that, you get specific numbness and tingling in the first three fingers. So the thumb, index, and middle finger, and sometimes even half of the ring finger. That's all median nerve and from a carpal tunnel compression.
Okay. I thought you get carpal tunnel by working in a repetitive job. I don't do that type of work, so could I have carpal tunnel?
Yeah. So I hear this a lot. There's quite a few people that the misconception is that you have to be in a repetitive industrial type of a work placed in order to get carpal tunnel. But that's not true. You actually can get carpal tunnel through a lot of different ways. So again, I mentioned pregnancy, so sometimes just the increased fluids from being pregnant can put compression on the median nerve. Sometimes autoimmune, so things like rheumatoid arthritis and lupus and other type of systemic type issues can create inflammation to the tendons. Arthritis, for people that have degenerative changes, the carpal, like I said, the floor of your carpal tunnel is the carpal bone. So if they are starting to have degenerative changes, then it changes the way that the carpal tunnel is shaped, and so you can get compression from there. So you don't necessarily have to work into a factory to get carpal tunnel, but that is one common cause.
What do I do if I think I have carpal tunnel?
So I think the best thing is, if you have not had an opportunity to talk to your primary care physician, we do take direct access patients. So it is something that you can go into one of our KORT clinics and you can sign up for an evaluation. And so we do a comprehensive evaluation. We look basically from the neck, that's where the nerve is starting from, and then we sort of evaluate it down into the hand. And we want to identify where is that nerve being aggravated or irritated, and from that standpoint, that's how we treat it. So, so the first step would either be to talk to your primary care physician. They may refer you to a physical therapist or an occupational therapist, or you can actually directly come to one of our KORT clinics, and we can set up for an evaluation and determine what your issues are.
Can carpal tunnel get worse if left untreated? Can it cause permanent damage if left untreated?
So that's one thing that when I do an evaluation, there are certain things that I look for that determines whether I feel like conservative therapy is the best way to manage your care. So one of the things is we do a neurological exam. So I'm looking at particularly the thenar eminence is innervated a lot by the median nerve or the carpal tunnel. And so if I'm starting to see significant atrophy or changes to those muscles, that's not something I want to wait around and watch. That can be something that can be irreversible. So if I'm starting to see significant changes or atrophy or wasting of those muscles, then I'm probably going to recommend that you have a consult with an orthopedic hand or orthopedic surgeon. The other thing is I look at sensation. So if you are very insensate, so you can't feel objects, you can't feel things like hot, cold, sharp, dull, you're dropping objects more frequently, things like that. That's another area that could be irreversible and probably would need surgery. The other thing that can really help us to guide treatment is what we call an EMG test, and that's a electrical myogram test. And what it does is it helps to determine the severity of your carpal tunnel. So a lot of times it may come back that it's mild to moderate, and that's something that you can conservatively treat and kind of watch for a period of time. If it's more moderate to severe, a lot of times the recommendation is to do surgery to release that compression so that you don't have long-term benefits or issues from that.
What does treatment look like with a hand therapist? How many visits does it take to get relief?
So typically the first day, like I mentioned before, I do a comprehensive evaluation. Just because you have numbness and tingling to the first 3 digits doesn't mean it's always carpal tunnel. So I need to identify exactly where the problem's coming from and then work on evaluating it from that standpoint. Typically if it is carpal tunnel, the things that I like to start with is I like to start with a nighttime brace. A lot of times when people talk about having carpal tunnel, they mention that their pain is worse at night. And a lot of things is they sleep in this awkward posture. So people like to sleep in this sort of flexed wrist position. And what that does is it compresses on that median nerve or that carpal tunnel, and then that makes your fingers go numb and tingly. So what the wrist splint does is it helps to keep it into a neutral position so that you're not sleeping in awkward postures. And I tell patients, it's kind of like if you haven't slept for 8 hours, you're going to be pretty irritable during the day. If you've been laying on your nerve and irritating it for the 6 to 8 hours while you're sleeping, it's going to be pretty irritable for you during the day. So a wrist splint can be very helpful for giving that good posture at nighttime to prevent that irritation. The other thing is we want to stretch. So again, the nerve starts from the cervical spine and goes all the way to the hand. So I want to do stretching that helps to get those nerves moving and gliding and not tight from the muscles that start from the neck all the way down into the hand. So we do a very good comprehensive stretching program. And then sometimes it's ergonomics. It may be what you're doing at your desk, sitting at your desk for 6 to 8 hours while you're working that we can kind of change and modify. So typically from a therapy standpoint, usually in the first session, you see a significant change as far as your symptoms. And then usually, depending on how often you need to be seen, I would say around 4 to 6 visits, you should be seeing quite a bit of difference from when you very first started to after.
I have a question, actually. You mentioned the neck. Is cell phone use related to carpal tunnel, or?
Yeah, so it can be. So cell phone use and then also desk use. So again, if you're answering the phone and this is something that you do for large times of the day, having that neck in sort of that side bent position. So if you think about if you're doing that for 6 to 8 hours, these muscles are starting to get shortened, these muscles are getting stretched. So a couple things you can do for that is, one, I may recommend that if you're at a desk situation or a desk job, to actually use a headset. So that way you're not having to rotate your neck side to side to hold the phone. The other thing is if you have the ability and it's on your cell phone, use the speakerphone or use the microphone or the voice command. So that way you're not having to, again, hold the phone up for long periods of time, and it allows that nerve time to rest.
What about texting with the thumbs, and is that bad for carpal tunnel?
It can be, yes, again, and that's, that also gets into some other common diagnoses that we see as well. But again, I think, the voice command, that's one thing, a modification that I'll make to some of my patients is, use the voice command or sometimes even using your index finger to kind of do the scroll versus just doing the typing with the thumbs can really start to allow those other joints to sort of get some rest breaks from that.
I was diagnosed with carpal tunnel syndrome 5 years ago and was told that it was only mild based on the EMG. My symptoms are somewhat manageable. More damage by not having surgery?
That's a very good question. So, and that's something that a lot of times people will say, I've had this for a long time. And again, I think as long as you're seeing a couple things, that the muscles in the thenar eminence are not having significant change. So if you're starting to see more flattening or wasting or atrophy of those muscles, that's something that you want to get attention to a surgeon for. If you're starting to see increased numbness or tingling to the fingers where you're dropping things, or you're in your splints at nighttime, it's controlling your numbness and tingling, it's controlling your pain, you're doing stretching exercises, by all means, I think it's something that you can continue to work on conservatively, and it's not a surgical intervention at that point. But even on some people, let's say that, you ride a bike, a motorcycle bike, and, at first it took an hour for you to be able to ride your bike and your hands would go numb and tingling. Now it's taken 15 minutes for you to ride the bike beyond surgery. So sometimes they'll use anti-inflammatories. Again, we talk about splinting to keep the wrist in good position. We do I don't do, but the physicians will do steroid injections at the carpal tunnel to kind of help decrease the inflammation. So it's not always a surgical intervention. There are some things that can be done before to kind of help manage the symptoms for a period of time as well.
Does insurance cover occupational therapy?
So we do accept most insurances. Whenever you schedule for an evaluation, that is something that we have in our front office. Our PSSs will actually get your insurance information. They will tell you what your benefits are, so you kind of know what to expect at the time of your appointment. And we also allow direct access. So if it's something that you don't necessarily have to be seen by a physician, we can do your evaluation, and then if it's an insurance that we need to get from your physician, we can communicate that with your physician to get that signed off on for.
Okay, and how do I schedule an appointment?
So we have several therapy KORT locations throughout Kentucky and Southern Indiana. You can visit us at KORT.com, or our phone number is 800-645-KORT. All right, thank you guys for joining us today. I appreciate you all submitting your questions. And if there's anything that we can help you with as far as answering further questions, feel free to either give us a call at that number or visit us on our website. Thank you.